Kenya Devolution Civil Society Organizations Working Group demands that Ruto fulfill promises of surrendering devolved functions to the county governments. Kenya's public health is in turmoil, with primary healthcare services deteriorating due to unfulfilled promises and administrative bottlenecks. President William Ruto has twice reneged on his promise to transfer devolved functions to county governments, which, had it been done, at least 275 billion would have gone to counties to alleviate the suffering people face.
Delayed implementation of this commitment is derailing implementation of the devolution promise, which promised public participation, accountability, proximate and quality service delivery, and equitable development, just to mention but a few.
The national government is clinging to function so that it retains the money. We are still negotiating on the basis of 15% of the revenue should go to counties. No, money must follow function. You mean the county governor cannot count the number of community health promoters in their counties and give them a mosquito net, tablets for supplements and deworming? That has to be a national government function. This is just greed of power and resources that must stop.